This is another oral presentation of my group where I think is probably the most important presentation of my group in this conference. So what we did is that patients who received an induction treatment, autologous transplant, plus minus consolidation, and maintenance with lenalidomide, at the time that they had achieved sustained MRD negativity for 3 years, both in the bone marrow and in PET-CT, so we had also imaging MRD negativity, we stopped lenalidomide and we followed the patient. So 52 patients fulfilled the criteria of 3 years sustained MRD negativity, both in the bone marrow and imaging MRD negativity, and these patients stopped lenalidomide and we have a median follow-up of around 3 years. What we've seen is that approximately 25% of these patients became from MRD negative to MRD positive. None of them had immediate progression to myeloma, biochemical progression or clinical progression before going from MRD negativity to MRD positivity. Second important design of this study is that for those patients who become from MRD negative to MRD positive, lenalidomide was readministered at the dose of lenalidomide maintenance that the patient received at the time of discontinuation. So from those patients, I think there were 12 patients who become from MRD negative, MRD positive. From these patients, only 4 progressed, even with the readministration of lenalidomide, progressed to myeloma. 3 of them they had biochemical relapse and 1 of them clinical relapse. So in general, we can say that if a patient has 3 years of sustained MRD negativity, the probability of progression after the stop of lenalidomide maintenance was only 7%. And we didn't see that this 7% had a specific characteristic. For example, if all of these were high-risk patients, these 4 patients were 2 of them had high risk, 2 of them standard risk disease.